Are you a woman living with rheumatoid arthritis and struggling with menopause symptoms? Are you wondering if hormone replacement therapy can help you or rather put you at risk? In this video, I will discuss how menopause affects women with rheumatoid arthritis, if menopause can increase the risk to develop rheumatoid arthritis, and if hormonal replacement therapy is helpful for females with rheumatoid arthritis to help them with pain and improve their inflammation. Let's begin.
Rheumatologist OnCall.com.
Hi, I'm Dr. Girnita, a board-certified rheumatologist that is treating people with rheumatoid arthritis every day. Many of my patients that transition to menopause are affected by the hormonal changes that are happening during this time of their life, and they are interested to know about hormone replacement therapy. Before we understand if this therapy is helpful or not, let's discuss about what is menopause. Menopause is a normal phase of a woman's life, and it happens typically around the age of 51 when woman's menstrual cycle stops happening. And during this time, there is a decrease in estrogen levels, which can lead to many unpleasant symptoms like fatigue, hot flashes, night sweats, sleep issues, bloating, constipation, acid reflux, but also more achiness in the joints and muscles, and vaginal dryness, which can be very bothersome for many females. During menopause, the bones start to lose a lot of calcium, and in time, if not treated, that can cause thinning and will increase the risk to develop fractures in the next 10 years of your life. Now, can menopause cause rheumatoid arthritis? As you probably know, rheumatoid arthritis is happening more in females than males, and during menopause time, there is an increased risk to develop rheumatoid arthritis. There are some studies that show that the risk of rheumatoid arthritis is increasing during this time, and the reason is the sudden decrease in the estrogen level that will increase the level of inflammation in the body. The hormonal changes paired with a genetic predisposition with stress, poor nutrition, smoking, or other environmental factors will increase your risk to develop rheumatoid arthritis. But the good news is that many patients that develop rheumatoid arthritis during menopause might have milder forms of the disease. But you should check with a rheumatologist and get the diagnosis and get treatment. For those that already have a diagnosis of rheumatoid arthritis, will menopause worsen your symptoms? And the answer is yes. Some patients may experience more inflammation with more joint pain, more stiffness, and more swelling in their joints. There is also an increased risk to develop flare-ups of rheumatoid arthritis during this time. But sometimes the symptoms that you experience might not be related to rheumatoid arthritis, but rather they are the symptoms of menopause. Now, in my upcoming book that will be released in just a few months, I am discussing in depth about all these changes that are happening during menopause, and I will give you a great overview and a comprehensive approach which will include nutrition, exercise. I will also discuss tips that you can use to reduce the level of your stress in your life and will also help you sleep better. Sign up to my newsletter on my website or send me an email if you want to receive more information about rheumatoid arthritis and my upcoming projects. Hormone replacement therapy. Does it help? Many of my patients want to know what can they do to help their menopause symptoms, and they are asking me about hormone replacement therapy. For many years, hormone replacement therapy was thought to increase the risk of breast cancer and heart disease. However, more recent studies did not confirm the initial results published in the 2000s. And over time, there have been a lot of females that benefited from hormone replacement therapy. If you want to learn more, listen to my podcast where, together with an expert in menopause, Dr. Prabhakar, we are discussing the types of hormone replacement therapy and when is this treatment appropriate. I will link my podcast in the description of this video. Let's return to people with rheumatoid arthritis. According to the American College of Rheumatology guidelines, hormone replacement therapy is appropriate and it is recommended for most postmenopausal women with rheumatic conditions, including patients with rheumatoid arthritis. But it is contraindicated in patients with lupus who have anti-phospholipid antibodies. In those patients with lupus and APL or anti-phospholipid antibodies, hormonal replacement therapy is contraindicated as it will increase the risk of blood clots. But it is important to note that while hormone replacement therapy can help you with menopausal symptoms and rheumatoid arthritis, it is not considered a standalone or a replacement for the standard rheumatoid arthritis treatment. So in conclusion, hormone replacement therapy can be helpful to patients with rheumatoid arthritis during menopause, but I always recommend you to discuss these options with your rheumatologist and also with an OBGYN to evaluate if this therapy is appropriate for you. Do not take hormone replacement therapy if you have a history of blood clots, cancer, or if you have a diagnosis of lupus with anti-phospholipid antibodies or anti-phospholipid syndrome. Please let me know in the comments below, did your rheumatoid arthritis worsen during menopause? Did you try hormone replacement therapy? And did that help you? I would like you to share your experience with other women in the world. And don't forget to like, share, subscribe, and hit the notification button if you want to hear more informative videos like this one. Until the next time, stay healthy, stay curious, and get informed. Thank you.
Rheumatologist OnCall.com